Hi, I'm Dr. Roger Owens with HealthQuest Physicians Group. I'd like to take a few minutes and share some information on a condition that we see on a regular basis called arthritis. Arthritis is literally just the inflammation of the joint or destruction of a joint surface. There's two main types of arthritis. There's a systemic type of arthritis, which is your body adversely reacting to your joints and causing joint destruction. That accounts for your rheumatoid arthritis, your ankylosing spondylitis, things of that nature. But by far the most common type of arthritis that we deal with, or the most common type of arthritis that causes disability, is called osteoarthritis. Osteoarthritis accounts for 80% of all disability. And oftentimes you can do things to alter the course of it. Here's a fine example on x-rays of osteoarthritis and the way that it presents when we see it in our practice. If you look at the picture here on the left, this is a normal side view of the cervical spine or the neck. Here's the head, here's the spine. We're looking at it as if we were looking into the ear. When we analyze out the neck, we go through and we draw these lines across the bottommost aspect of each one of the vertebrae, and you'll notice that these lines converge at a fairly central point. The front of the atlas bone, if you drop it straight down, should fall right through the front of the 7th cervical vertebra. Now this is a normal curvature in a normal spine that develops as an infant child prior to you being able to support your head. However, through injuries and accidents, you can lose that curvature. This structural misalignment leads to a condition called osteoarthritis. If we look at the example of the x-ray on the right, the first thing that you can notice very clearly is that these lines are not converging. You can draw them from here to Kansas City and they're not going to come together. The atlas vertebra, the very top bone in the neck, when you drop a plumb line down, it's falling well out in front of the 7th cervical vertebra. And if you look through the mid portion where the lines are actually diverging, you can notice that the disc spaces are beginning to deteriorate. This degeneration takes place due to two things. First off, the structural misalignment that causes the wear and tear on the disc material because it's softer, it's made out of cartilage. And the second thing is the disc, when these vertebrae stop moving the way that they're supposed to move, don't have the proper blood supply to keep the disc healthy. Now, one of the common myths associated with osteoarthritis is that it occurs due to age. The only thing really arthritis and age have in common is that they both do take time. If you look at the disc here in the upper portion of the neck that was not injured, you'll notice it's nice and wide and dark and healthy. However, it's the same age as this disc down here that's deteriorated. The only difference between these discs is that this area of the cervical spine or the neck was injured, and this is a typical presentation of a whiplash injury, and it went undetected or uncorrected over a long period of time. Now naturally, the best way to diagnose osteoarthritis is with an x-ray. However, there are other signs and symptoms that you can figure out that something's not working quite right. If you're waking up in the morning and your spine is stiff, you have trouble moving, if you have trouble changing lanes, if it's getting more difficult to back up your vehicle, it's a good idea to have your spine checked to see if you also have some osteoarthritis. There are some things that can be done, not only at home, but through your chiropractor, that can help to either stop or minimize the damage that's being done. If you have any questions, feel free to contact us at HealthQuest Physicians Group at 635-9655. Thanks for joining me.